Hello there. This is the Therapy Monthly Conference Call for February 2019. This is the recorded version of the call. So we'll go ahead and get started. Thank you for all the new therapists on LHC Group who are joining the call for the first time. For all new therapists who have joined LHC Group and also joining us with the Almost Family acquisition for the first time to our new therapist. I want to extend a warm welcome to all of you. First item on the agenda is Therapist of the Month announcements for November and December of 2018. So for November of 2018, our physical therapist of the month is Melissa McCauley from Capital Region Home Health in Jefferson City, Missouri. Our occupational therapist of the month for November is Mandy Butler from Louisiana Home Care of Alexandria, Louisiana. And our speech therapist of the month is Dawn Hamilton from Folkway Health Home Services in Warrington, Virginia. Congratulations to our November 2018 therapist of the month. Our December therapist of the month for physical therapy is Danielle Darling, physical therapy assistant from Metairie Care Tenders in Lake City, Florida. Our occupational therapist of the month is Allison Hyde, a occupational therapy assistant from Cosa Valley Home Care in Sylacauga, Alabama. And our speech therapist of the month is Amy Rucker from Elite Home Health in Calico Rock, Arkansas. Congratulations to you guys as December 2018 therapist of the month. We want to talk a little bit this month about Home Care Home Base and the significant changes that were made in the functionality of the system in late 2018. Most of you guys will remember a company-wide call where we introduced these changes, and as we've run across multiple chart audits over the last several months, we've noticed a trend in the coordination of our therapy plan of care goals to the therapy goals and status items. So with the new changes in addition to the short-term goal, long-term goal functionality, our therapy goals and status items now tie directly back to our plan of care goals and are included in our actual orders. So if you're performing a start of care, those therapy goal status items become a part of the 485. If you're doing an add-on evaluation, those items will either be merged onto the 485 or onto your add-on order. So it's imperative that when developing our plan of care and selecting our pathways, we are appropriately tying back the appropriate items in therapy goals and status to support our goals. So for example, the physical therapy gait goal reads, patient will achieve highest functional level as outlined in therapy plan of care objective goals with gait quality, ability to ascend, descend steps and ramps, and or functional ambulation to navigate within the home and or community. So that's our basic plan of care goal. That goal can be and should be edited to make it specific to the patient. The therapy goals and status items that tie back to gait, things such as gait distance, assistance on level and unlevel surfaces, performance with stairs and steps, type of assistive device, gait speed, should all be documented in therapy goals and status. If there's a specific deficit that doesn't have an appropriate item to address it in therapy goals and status, that deficit should be addressed and documented in the plan of care goal by editing it when you're completing your new order. An example of this would be if you're working to improve the patient's function with the use of an AFO and improve forefoot clearance, you would want to ensure that those items are included in your plan of care goal. So that goal should be edited when performing your therapy order. There's also a number of items that do not have appropriate items for comparison in therapy goals and status, and in those plan of care orders, you will notice that the asterisks still remain. Those asterisks should be addressed and customized to the patient. The second item with therapy goals and status is how that compares to standardized scorable tests. we should always know that all of our objective tests should be documented in therapy goals and status. The standardized scorable test form allows us to document standardized tests without the use of a paper form. So for example, the Barthel test for our occupational therapist requires a form to complete. That test should be completed in standardized scorable test, the answers documented, and when you get the results of the test, you will get a score that comes up in standardized scorable test. That score or status should be transferred into therapy goals and status in order to document the patient's current status and establish goals and time frames in therapy goals and status. The functional reach test does not require a form to complete. Therefore, it is not available in standardized scorable test. The functional reach test can simply be performed and documented in therapy goals and status along with the appropriate goal and time frame. On the physical therapy side, the timed up and go versus the dynamic gait index. The timed up and go does not require a form. You simply complete the test and document it in therapy goals and status. The dynamic gait index does require a form. Therefore, you would complete it in standardized scorable test and then transfer those items into therapy goals and status. There's also a number of items in therapy goals and status that have do not use after the particular item. Please do not use these items. They are all available in another location which is more appropriate within therapy goals and status. We also know that in order to pull accurate data for a particular test to substantiate our treatments and interventions that we are performing with our patients, we have to have these items included. So do not use the items that have do not use on it, and appropriately find the more appropriate section in therapy goals and status to document those in. Our Elias Therapy CEU courses are also available. Most states have either an approved course or course provider listed on their website. Our current recommendation is that you go to your local board website for your state and specific discipline and identify which courses or which providers are approved in your state for CEUs, and then go into iTrain and find the appropriate course to take. We want to ensure that no one is taking courses in iTrain expecting to get CEU credits for those courses, and then that particular course is not approved by your state board. So first go to your state board website, find the course or provider, and then go into iTrain and find the appropriate course. The next item on the agenda is OASIS D. As you all know, the OASIS D was implemented by CMS on January 1st. With the OASIS D implementation, there was a number of changes, including addition of some items for assessment, and there was also the removal of some items. One of the items that we're getting a number of questions on is the GG0170 item. That item is particular to the functional abilities of our patients. The GG0170 item specifically asks for documentation and goal achievement of the patient for rolling left and right, sitting to lying, lying to sitting on the side of the bed, sit to stand, chair to bed to chair transfers, toilet transfers, car transfers, the ability of the patient to walk 10 feet, walk 50 feet with 2 turns, and walk 150 feet. The ability of the patient to walk 10 feet on uneven surfaces, the ability of the patient to go up and down 1 step, 4 steps, and 12 steps, picking up an object from the floor, and if it's appropriate that the patient uses a wheelchair or scooter, the ability of the patient to wheel 50 feet with 2 turns and wheel 150 feet. So that's a lot of functional items that our nurses and starter care clinicians who are either physical or speech therapists are required to document with the new OASIS D. We need to ensure that our documentation from a therapy standpoint supports and substantiates the documentation from the OASIS so that we can collaborate between disciplines to ensure appropriate scoring of the OASIS. We also want to ensure that everyone is not forgetting about the OASIS M items. So those functional M items, such as transfers, ambulation, upper extremity and lower extremity dressing, toilet transfers, bathing, are not being de-emphasized. We continue to be judged on our agencies for our star ratings on the OASIS M items. So it's really important that we do not de-emphasize these items and that we continue to place a focus on appropriate scoring of M items. The GG items do play a part in our scoring system, and they are used in the calculation of risk adjustment. So those are also very important, and we need to ensure that we're appropriately scoring both of those. Clinical tip today is lymphedema. So we've had a number of questions come out regarding lymphedema. So if you are a therapist who is lymphedema certified or treats lymphedema patient, we want to make you aware of a local coverage determination that was issued by one of the CMS intermediaries. And to quote, "The goal of therapy is not to achieve maximum volume reduction, but to ultimately transfer the responsibility for the care from the provider to the patient and our caregiver, generally within a 1 to 3 week time period." The LCD goes on to further describe appropriate treatment of lymphedema patients, and that guidance will be included in the call notes from today's call. The second clinical tip is in regards to energy conservation. So we're going to also have attached to today's call the energy conservation tip sheet. So how can we help patients with energy conservation issues? Many patients with diagnoses such as rheumatoid arthritis, myasthenia gravis, ALS, individuals who are undergoing cancer treatments, COPD, heart disease, and the geriatric population can be appropriately treated for energy conservation. We want to really emphasize how we can help these patients minimize muscle fatigue, joint stress, and pain. We can teach patients to use their bodies efficiently and doing things in a sequential way that can help them save their energy. The tip sheet goes through a number of patient tips that can promote energy conservation. Please reference the tip sheet for lymphedema and energy conservation after reviewing this call. As always, our therapy team is here to help in any way we can. If you have questions, feel free to contact us at therapy@lhcgroup.com. The call notes for this call will be posted on iTrain. If you go to Catalog, then Therapy, then Monthly Call Notes, those notes should be easily accessible. I want to thank you all for joining this recording today of the Monthly Therapy Call. I hope you all have a great day, and feel free to reach out to us with any questions or concerns. Thanks again. Bye-bye.